Welcome, everyone. It's great to be here. I've been affiliated with Techonomy now for 12 years, 11 years, something like that. So it's great to be here. And I'm meeting Kristin and Anne for the first time. I know Sumit maybe just for 4 or 5 months. And I always love and I get stimulated when I meet with entrepreneurs because I remind all my, and these are the ultra entrepreneurs. I don't know how many companies you guys have started, but I know this is your 5th, right? So, and I remind my banker friends, my PE friends, my VC friends, my lawyer friends that they wouldn't have a job if it weren't people like these guys, right? They don't like to hear that, but they do. So maybe just, can you hear me now better? Okay. So maybe just a quick name, rank, and serial number for each of you, and then I'll ask a few questions. We only have 25 minutes, and I'm not sure we're going to, the previous session ran over a little bit, so we might get cut into a little bit, but we'll go fast. So.
Sure. I'm Anne Garnier, the co-founder and CEO of Lisa Health.
Hi, I'm Kristin Apple, president of Linus. We are insight, strategy, and innovation consultancy.
Sumit, Nagpal, founder, CEO of Cherish Health, Cambridge-based. We're in the business of building sensors to help people in their homes, people who are either aging or living with health challenges.
So let's dive right in. So the first question I want to ask for each of you, which is the state of health equity access in a post-pandemic world, and some of the lessons that we learned over the last 2 or 3 years. Maybe each of you could comment on that.
Sure. Well, I didn't mention in the intro, but we offer a digital health platform for menopause and healthy aging. So my focus is in women's health. So my perspective on it really comes from the women's health angle. I think actually, encouragingly, the health equity has improved for women through the pandemic. We did see, through data, surveys from Rock Health, that women's health access actually increased, and women actually outpaced men in their use of digital health apps and telehealth and wearable technology. They also showed that people of color, actually women of color, while they also had good access to digital health technologies, their experience, they were more dissatisfied with their experience, particularly the live telemedicine interactions that they had. And then they also showed that people who are disabled, who are aging, actually, and people who are on Medicaid actually were accessing digital technology almost on par with, the average survey respondents. So people are engaging. They do know how to use technology. We just need to be more culturally competent and focused on how we design those experiences for those populations.
Can you speak a little louder?
Sure.
Good. In terms of access to care, the pandemic, while it shut down the traditional 4 walls of care, we found in a large study that we did with 1,000 adults, the ages between 60 to 79, that the accessibility and the openness to accessing care in new ways was actually accelerated by the pandemic. I know many of you who've been on stage in the last couple hours have talked about it, and we'll spend more time talking about it today.
So I happen to agree with everything you've said, with one really important caveat, which is the pandemic really laid bare just how challenging the lives are of people who are either living with frailty, older people, or people who are immunocompromised. Really laid bare just how challenging their lives are, especially in the institutions that are supposed to care for them. I think the number of stories that we now have heard about senior living facilities and nursing homes where people simply didn't get even basic testing, much less anything beyond, is over the top. And that's not just in the US. Within the NHS care homes across England, for example, the death rate was super high and people were dying without the comfort of their loved ones. And it was pandemic levels for the lack of proactive, preventive intervention, right? That was such a huge challenge that was laid bare. And I think that one of the biggest things that we got out of the pandemic was an understanding of these people's lives They're us eventually. There are, parents or grandparents today. They're us eventually.
Me now.
Right. Yep. And it also gave us, quite a bit of empathy for what's happening. I think, given that, this movement to providing telecare on the one hand and providing digital care along with it, will of course continue, and it'll evolve in different ways post-pandemic. But really, how we think of where people as they get older wind up, and how they live with dignity, and how they live with independence, perhaps even with joy over time. Those things, those challenges are now in our minds much more than they ever were. And I think it's now a real opportunity, given this experience that really shoved it in our faces, to act on this.
So maybe just an extension, thank you for that, just an extension of the question, which is, are there any behaviors that were modified in COVID pandemic that are now permanent behaviors? Some of them are temporary, some of them are permanent. Any of the ones that you've noticed that seem to be locked in place going forward?
Well, I do think we see a sustained use of telehealth for women. They find it much more convenient. They lead very busy lives. And so I think we will see that. I also think the use of wearable technology among women over 40 has increased as they take more accountability, but also as companies like ours actually provide more contextualized and meaningful support for the data that comes through that sensor technology.
Yeah, and from what's permanent or what's here to stay, it's the option to care, the optionality. So whether it be, having to decide for those adults that are between the ages of 60 to 79 or even older, do I actually need to go see my doctor for this appointment, or can I do it online, or can I just have a phone call? The thing that's changed is that doctors are open to it now as well. So, telehealth has been around forever, 15 years, 10 years. But now, physicians are open to it, patients are open to it, and we're all accessing care in the ways that we want to.
Interesting counterpoint from yesterday, Babylon Health. Some of you know, UK company, started off in working with the NHS. Yesterday announced that they were shutting down their clinic and telecare services in the city of Birmingham. Right? They were just literally abandoning the contract with the NHS. And this is sort of another nail in the coffin of their programs that they've been promoting since the beginning of the pandemic. They had this giant IPO, and they're having a really hard time making their telecare model work. Their model of remote care, not just teleconsultations, but capitated contracts with trying to manage populations. They're having a real challenging time making that work, and that's not singling out Babylon, because this story is actually repeating across many, many companies. You take Teladoc with the massive $7 billion write-down that they had to do of their acquisition of Livongo, right? That was another early warning sign that things are not quite as peachy as they appear. And so I think that the situation is actually much more nuanced. Yes, more and more of us are using digital services. Yes, there's better access to a lot of things. My doctor, is a concierge medicine doctor. I get to chat with anybody at 2 o'clock in the morning if I have to. So that kind of stuff is available for people who can afford it. But there are challenges with cherry picking the healthiest segments of the population, leaving the harder patients for the safety net traditional providers to mop up, right, or deal with. There are so many challenges. So the situation is quite nuanced. We're in the early days of this evolution, rather than, we've made this quantum shift. We're not there.
So Anne, maybe tell us a little bit about the inspiration for creating your company.
Sure.
What motivated you, and what keeps you going?
Well, I've done a lot of work in women's health over my career, but primarily in pregnancy and fertility. So when I experienced the menopause transition firsthand, obviously a highly empowered and knowledgeable healthcare consumer, I was like every other woman. I was completely blindsided and unprepared. I was
Pull it right up.
I was completely blindsided and unprepared. I thought, wow, if it's this hard for me, like what is this like for the average woman? So I did a deep dive, and it's pretty abysmal. Fewer than 7% of doctors are even trained in menopausal care. So we're talking a very complex, lengthy life stage of like 40 and up, but generally 40 to 70. And I just became extremely passionate and knew that technology could really transform this life stage for 3.8 billion women, half the population. Every woman will experience this life stage. And it's bordering on criminal neglect that women have suffered so long in silence and not getting the care and support that they need. So talk about an underserved population. I would say this is one of the biggest underserved populations we have on this planet.
Maybe what's the status of the company? How big are you, and are you raising money? Or? Oh, it's okay, sorry. I tell you, it was my gesticulating. Okay. Did you hear my question?
I did.
Okay, did you hear my
did.
question? All right. The current status of the business, and how big is it? Where are you? What's next?
Sure. Well, we raised a seed round, which was led by Radical Ventures, and we recently launched our app Midday in collaboration with Mayo Clinic and SRI International. So we are off to the races.
Good luck. We'll talk later. So, Sumit, what was the inspiration for your fifth company? Because you obviously don't need the work.
My inspiration, as I like to say, is I was dropped in my head when I was a baby. So I can't stop doing this. The inspiration really was, all of this began when I was doing what I now call my sabbatical. Nobody from Accenture here, right? So, and I'll describe as my sabbatical when I was the global head for digital health at Accenture, 2017 till end of 2019. And in that process, built an entire practice that really zeroed in on what happens in the home and how care is moving to the home. And in that process, wound up testing a bunch of hypotheses. Number one, that more and more care is moving to the home. Number two, that we're seeing our population demographics changing substantially. By the end of this decade, there'll be more people, above 65, older than 65 than younger than 18 in this country. And that demographics already happened in other parts of the world. Third thing, that if our cost problems, our challenges with spending money on healthcare are not going away easily. And if we can find ways to predict, detect rising risk in the home, that we can do at least one of two things. Intervene early so that we can take out that ambulance ride, that hospitalization, that emergency room admission, because that's what costs so much money. If we can prevent those avoidable visits, we can actually take a big chunk of this economy, redirect that spend to better uses. That's one. And two, while we're at it, we can, by doing so, take out quite a bit of hardship, because nobody wants to be in the emergency room or in an ambulance, at least not the second time. And so we built a bunch of prototypes that were of sensing devices, which is the last piece of the thesis, that I fundamentally, having done remote patient monitoring in my previous companies many, many times, as a small part of the business, realized that this whole notion of patient engagement is the wrong way to think about stuff. And realized that if we're trying to get people to do things on a regular basis, we're going to lose. Because people fatigue, the novelty wears off of the device, the gadget, then people stop using them, they lose them, they don't charge them, then the support calls begin, right? And then the cost begins for all these institutions, and then it's over. Like, I have not, to this date, run into a provider or a payer that sees any of these technologies as anything other than new cost to delivering care, as opposed to an opportunity to take out cost by changing how they deliver that care, right? They're not redesigning their care pathways. This is new cost. And then you layer on all that support stuff, calling, grandma every morning and saying, hey, did you step on the weight scale? We didn't get your weight. And then sending the man in the van over to fix whatever Bluetooth wasn't working, right? That stuff sucks. It kills any business. And so we said there's got to be some way where we don't rely on people to change behavior. I don't believe that people change behavior sustainably over time for this stuff. For relationships, maybe, for certain things, maybe, but for this stuff, absolutely not. And so we said, what can we do where people don't have to think about this stuff? There is no engagement. That if something's going wrong, we can actually find out before someone winds up in that ambulance and send a nurse home or call them and intervene, give them the diuretic, give them what they need before that happens. What's the predicate? You know, my customers were companies ranging from Amazon to Walmart, and every one of these companies, when you ask them, well, how do you sense? They'd point at this kind of stuff on your chest, stuff on your body, stuff that you use. And that was anathema to the thesis. So we said, okay, what works? And we realized it was staring us in the face. Stuff like home security, once it's installed, it just works. Stuff like smoke detectors for alarms, once they're installed, you don't think about them until they start making noise about a battery, right? So we said, what if we could do that, turn it on its head, and make it about the person rather than their property, the sensing, and that's how Cherish was born.
And what's the status of your company?
So we've now got our release candidate devices. These are all radar-based units, no cameras. We've lots and lots of lessons learned. They're going into beta testing in October this month, and we're launching in January. We're going to have a pretty substantial launch. We can literally, with this device, looks like a speaker, sits on a coffee table or a dresser, faces into your home, sees through walls, and we can literally track multiple people, their body position continuously, whether they're sitting, standing, walking, lying down, rising, or falling, right? So we can detect falls. We can detect very, very complex falls. And we have already proven that we can pick up your biometrics. Basic ones are step count and gait and time to rise and angle of recline while you're asleep. That stuff's done. We've also proven that our technology can pick up your heart rate and respiration from 40 feet away through a wall, right? So that will become useful over time once we perfect that as well. It's all AI once we've got the signal.
Kristin, maybe some insights from you on the state of healthcare wellness for seniors going forward.
Yeah, so for older adults, I mentioned Linus conducted a study of 1,000 adults between the ages of 60 and 79. We busted a couple of myths that our team and Gen Pop have about aging adults, and one is they don't want to be tracked. False. Good news for Cherish Health. 2 is they're old, and 3 is they're sick. And the reality is between the ages of 60 and 79, 80% of that population thinks that they're healthy, they're active, they're not old, they're not frail, they're not decrepit, they're active, right? And so this is a myth that we need to bust as an industry to help them, age at home and deliver that care at home. We found that one of the things that we're really interested in and passionate about is digital diagnostics and how can digital diagnostics transform the way of care. And so we wanted to know, what does this population think about digital diagnostics? Are they comfortable with them? And the answer is yes. 43% of this population says, yes, I am comfortable making the diagnosis, using my digital device. That's totally fine. But what they want is a secondary opinion from a healthcare provider. So this idea of triage me, so being able to enable older adults to make their own diagnostic or diagnosis, but then actually give them the HCP, give them the nurse practitioner, the ability to call in, to dial in, is something is a big opportunity.
And don't call them seniors.
Don't call them seniors. I didn't say it, but
I realized that I did.
It was subtle.
I forgot.
Yes.
Anyway, we have just under a minute. Anyone want to offer some predictions about the near-term future?
Yes. 2023 will be the year of menopause. Women are rising up. They are shedding this stigma of invisibility and shame around this life stage. And I think we'll see innovative employers starting to offer benefits in the workplace. which is a good thing. And if they don't, we have a group of menopause entrepreneurs who are amassing an army of women worldwide and are prepared to shame employers, payers, and health systems, and even the healthcare services companies of the world. So all of you men, I say mostly men in this audience, please join us and take this to your companies, your boards, your HR folks, and be a voice for us, for women in midlife.
I think we're going to have to end with that prediction. Thank you very much. No, I think we're.
No, that is great. That was a great ending. Thank you, Anne.